We're here at Second Baptist Church of Santa Ana, and we have been here for 20 years. Historically, because of racism, Blacks did not have very many opportunities to network except for the church. So the church became a hub for networking, for tutoring, for counseling. After the pandemic, we see that behavioral health needs have grown exponentially. Depression, anxiety, addiction, some things you can't just pray away. We realized that we needed to do more.
The African American population is not effectively served with mental health interventions. Access is a big issue because certain communities, certain cultures are not very comfortable with mental health treatment. And so if they don't show up, sometimes the services or the programs don't go looking for them. New Beginning Fellowship is a nonprofit organization that provides mental health and substance abuse prevention services. We wanted to get Second Baptist Church to help us to access the population that we wanted to work with. African Americans needed mental health intervention. These two organizations are only about 4 miles apart, but yet we weren't in contact with each other. I wasn't sure where to begin. I reached out and called Pastor Pitts.
Amen.
When Leroy reached out to me, I was excited. We don't necessarily have the funds to do the things that we need to do for our congregation. So when there's external resources that can provide experienced, trained people, we jump at it. There's so many things that the community trusts the church with that they don't trust other organizations with. And so if we can be a conduit to help bridge the gap between the community and the resources, I think that's what we want to do.
We vetted New Beginnings. We said, okay, we need culturally sensitive counselors. We can't just send them to anywhere, and New Beginnings is definitely a great fit. So we have decided to add them to our list of organizations that we would refer someone where there is a need and it would be appropriate.
When we begin to give him praise.
People are still getting used to the thought of opening up or going to get help. I lost a brother to suicide in 2000. We didn't get counseling for that. Years later was the first time that I actually talked about it. I know the importance of getting help. It doesn't make me weak or sick. It just makes me wise to take advantage of the resources that are there for me.
As we are opening ourselves to provide additional services, we're finding that more and more people are coming. I'm also encouraged that our membership is opening up and being more forthcoming with their needs to be able to connect with like-minded people who are vested in creating a healthier environment is key. It's really key.